Hello everyone and welcome to another Your OT Tutor freebie webinar. Again, I'm joined by the wonderful Ilissa Liew from Unicare Health, who always comes and helps me out with these tricky pressure care type topics. So what we're covering about today for Worldwide Stop the Pressure, not really a celebration day, what would you call it? Like an awareness day.
Awareness Day. Yeah.
We're talking about pressure injury myth busters. So some of the things that you may have heard about pressure care that you think, is that true or not? Or some of the things that maybe Ilissa definitely has seen clinicians get wrong from time to time. So it's going to be a quick fire session, probably about 30 minutes or so, where we'll go through our top 5 myths. Ilissa will share her insights. And if you do have questions, drop them in the chat. If you're watching the recording and you have a question afterwards, you're welcome to send it through to me, or you can contact Ilissa directly as well. I'll make sure that her details are wherever you're watching this recording. But let's take it away. First of all, introduction to Ilissa. She's a clinical educator at Unicare Health who's been an OT for many years, specialising in education now, which is wonderful that Unicare have that sort of branch of OTs dedicated just to providing clinical education around lots of different assistive technology options. But feel free to add in anything else that you'd like to say about yourself. Anything else you'd like to share, or should we launch right in?
That is perfect. Yeah, let's just launch straight in.
Okay. So the first myth that we're going to bust is that all pressure injuries should be managed with a dynamic air mattress. What would you say about that?
So this one, I'm just looking, and I was saying to Claire earlier on, I'm looking away from the screen because I've got some notes on another screen just to note down some of the pointers as I've experienced some questions or get questions usually from OTs or colleagues in the field. So this one, I would say that it is not true. Okay. So first thing first, location of the pressure injury. Okay. So for example, the most recent example that I can give you is we went through all the clinical justification, looking at the features of the dynamic mattress when I got an inquiry from an OT, because her client has got a stage 3 pressure injury. And the last question that I asked, because she said something that prompted me to think, hang on a minute, was where is that pressure injury? And she goes, it's on the ear. It's on the person's left ear. Now, and I go, okay, hold on a second, let's backtrack here. So if someone has got a pressure injury on the ear, for example, or on the shin, that's another one that's quite common. And if person's sleeping supine, not in contact at all on with those areas, then the person may not need or will not need that support surface or sleep support surface to actually offload. You may need to look at the actual root cause of the pressure injury and backtrack and try to address it from there. If the person do have a pressure injury on a location where it's in contact with the pressure care mattress, for example, then my thought is not just my thought, well, my advice, but certainly there's lots of evidence now, if you look up on recent evidence on support surfaces, is that we are, as clinicians, over-prescribing air mattresses. So dynamic air mattresses in particular is the ones that has the pump attached to the actual mattress unit. So usually you have either air cells, or it may be a hybrid type that is still attached to a pump. So hybrid could be foam and air. Okay, so we are over-prescribing those type of mattresses. The most important thing that we as clinicians, OTs, physios, nurses needs to be aware of is doing that holistic, comprehensive assessment. Okay, and a lot of the time, for example, if the person, let's just say the person have got a stage 1 pressure injury, can still self-reposition, meaning that they can roll side to side and they're still transferring independently in and out of bed, an air mattress could be quite likely an overprescription, because what is the person's mobility like when we change that mattress to an air mattress? Is it going to hinder the person's mobility in bed and therefore be counterproductive to assist with that treatment of pressure injury? So really going back to the basics, which is looking at the person's holistic needs. Okay, not every pressure injury require a dynamic air mattress, and certainly not every pressure injury require a pressure care mattress, because that depends on the location. So that's that first myth busted.
Yep, no, that's good to know. Yeah, I think sometimes we kind of just assume, oh, yep, so pressure injury, mattress, cushion. Hang on, if it's on their shin or on their ear, yeah, that's not going to be helpful at all. And like I say, you need to go back and see what caused it in the first place to be able to address it or prevent future ones as well. But yeah, that's good that the research evidence is suggesting that maybe the air mattresses aren't required all the time, because I think sometimes we feel like we're not giving best practice if we don't provide it, but we know that they do make it harder to transfer, or that clients may find them noisy or uncomfortable. So it's good that we're not doing harm by using our reasoning and prioritizing other things as well, as long as we've thought about what caused that pressure injury and what are we doing to address that root cause.
Absolutely. And sometimes the cause of that pressure injury could be the hanger of the wheelchair foot plate. And so then addressing that, because if the person's shin, for example, is resting on that and that's the cause of it, then let's address that, looking at the person's sitting posture, rather than go straight into a dynamic air mattress or a pressure care mattress.
Yeah, like I say, it's like the Band-Aid effect, isn't it? Oh, there's an injury, let's put something on it now. But you can't avoid thinking about what caused it in the first place. So
yes.
Yeah. Okay. We'll keep plowing through. Next one is something I think definitely there could be some OTs that get this wrong. So if that's you, don't feel guilty. I probably would have made the same mistake myself if I was doing this regularly, but do you add the bed extension bolster to the head or the foot end of the bed? So I'll let you explain what a bed extension bolster is for the first place for those that don't know that, and then, yeah, which end it actually goes on and why.
Yes. So most profiling beds that you get from supplier, they are 2 meters in length. Okay. Now, if you have an individual that you're working with that's relatively tall, 6'3", for example, just the most recent one that came to my head, the person may require a slightly longer bed base. Now, not all, most profiling bed allows you to extend it. They may have a built-in extension, or you may need to get a little kit from that supplier to extend it to 2.2 meters. Okay, so your standard could be 2 meters in length, and then you can extend it to 2.2 meters. Most pressure care mattress are 2 meters. So then we go, what we're going to do then, if we do extend that bed to 2.2 meters, then we can obviously fill that gap. So lots of supplier, again, would sell a bed extension bolster. Now, the ones that we supply at Unicare Health, they're just really basic foam, okay? Different density, memory type foam. They're not pressure care or pressure tested, so to speak, for the lack of a better term. So what we always recommend is for clinicians to actually pull that mattress down and add the bolster to the head end of the bed. I know it's not very natural, because once you extend the bed, I think most people go, oh, okay, here's the gap. We're going to add that bolster to the foot end. But if you do that, then the person's heels are actually resting on the bolster. And you may have a dynamic air mattress, and heels, we know, is a very high risk area for pressure injury. So you always want the person's heels to be resting on their pressure care mattress, and then the bolster to go onto the head end. And usually it's 20 centimeters bolster. So, that's perfectly okay on the head end.
And what happens if the head end, the bolster's falling off? When people think, when I raise the bed, it's going to go down. What would you say about that?
Yes, so that is an absolutely very common reason for people to not add it to the head end. Now, then I would challenge you to go back to the supplier and say, these beds that I've got from you, does it come with mattress retainer? I am very passionate about mattress retainer. So on most electric profiling beds, you will have mattress retainers. It could be a little plastic that sticks out on the top end, foot end, and on the sides. And that actually keeps the mattress in place. And in this case, when you extend the bed base, you add the bolster to head end, that will keep your bolster in place. It should not fall off. Okay, so that's why you do need to look at sleep support system as a whole rather than we'll just get a mattress. So when you're looking at bed, it's important to look at those sort of features as well. They're small, but they're very mighty. And it's one thing that I think it's non-negotiable when it comes to bed.
There you go. The unsung hero of making beds work well is the mattress retainer.
Never thought of it. Yeah, yeah.
Excellent. Okay, we'll keep plowing through. The next one that we're looking at is true or false. Electric profiling beds have little impact on pressure injury prevention or treatment. So we're not talking about the mattress here, we're talking about just the bed itself. Does it actually make a difference to pressure injuries?
Yeah. So this statement is false. Okay. So on electric beds, there's lots of things you can do with electric beds these days. But the number one feature for pressure care is auto-regression. Now, if you haven't heard of auto-regression, Google actually tells you quite a bit these days. And I've actually recently typed that into Google and actually comes up with a really good image. But essentially what it is, as you raise the head of the bed, if there's only just that pivot point, then there's no auto-regression. When a bed has got auto-regression, as you're raising that head, it will elongate. So that backrest will move backwards slightly. Okay. Now, when I say slightly, it really depends on the manufacturer of that bed. Every bed is made very differently. I'll give you an example. Some beds can actually extend and give you an extra 17 centimeters. And you won't really feel it though in the mattress because mattress, the way that you have the thickness of the mattress as that comes up, it's absorbed, if you like, that length and the person sits nicely into it. But from a shear point or a skin shear point perspective or pressure build-up perspective, having that auto-regression as your backrest comes up and move out, it reduces shear, it reduces that pressure built up, it improves pressure redistribution, particularly for that sacral region. Absolutely false. Electric profiling bed has a huge impact when it comes to pressure injury prevention or treatment. Now, there are other things to consider as well. So, we have the standard electric bed, which means that you've got your high-low, back elevation, knee break. And then you have electric beds that have a little bit more profiling options. So you have the Trendelenburg and the reverse Trendelenburg. That's basically tilting the bed backwards and forward. And with the tilt, you can achieve a lot more profiling options, and that can assist your client with repositioning, changing, weight shifting in bed. So that also plays into that pressure injury prevention and treatment if the person has got an active pressure injury and has spent a prolonged period of time in bed.
Yeah, no, that's a really good summary. And I think, like you say, it's not just the mattress. We put on an air mattress, even if we do go down that road and that does the job. It's actually, even with that in place, looking at changing the position, not just for that offloading, but obviously sometimes it's for comfort, for pain relief as well, to change that position. Sometimes it's for function so that they can actually, if they're spending a lot of time maybe on bed rest, that they can actually still do as much as they can possibly in bed, which is helpful as well. So,
yeah.
yeah.
And to OTs that I've trained, I always say, we think of the seating system. We never think someone's got an IT pressure injury. Yes, we prescribe a cushion, but potentially we may need a tilting space wheelchair. And why are we not doing that for sleep support? I think we should be thinking about it from a sleep support system. So looking at mattress, but also the bed.
Yeah. And a little sort of hint, if anyone wants to know more about all the different bed profiling options, really unpack some of those things in more detail, Ilissa has already done another webinar dedicated just to that, which you can find for free. It's in the Learning Library where you'll find this recording. It's on my YouTube channel as well. So you'll be able to go back and unpack those in a little bit more detail as well. If you see all those buttons on the remote, you're like, yep, that looks fancy. I'm a bit too scared. I'm not sure what it will do. We go through a remote and make it a little bit less daunting to hopefully actually get a lot more impact out of what can be achieved with beds, because sometimes it is underestimated and not utilized to the best way that it could be.
Yeah.
So, Okay, our next one is myth or fact, AT like shower commodes or slings don't influence pressure injury prevention or management. So what would you say, what is the impact of, just your shower commode, your slings? I think we've already touched on it already, heading in terms of that holistic assessment, seating beyond just a surface that they're sitting on. So what would you say about these ones?
Definitely a myth. Okay, let's just start with shower commode because that's the first one that's mentioned there. I have had a client in the past who was set on a shower commode for 2 hours every morning. And that's his personal care task from start. When he gets out of bed, onto the shower commode, he get into the toilet, then the shower, out of the shower, get dressed in that shower commode, clean his teeth, then the grooming and the shaving, for example. That's 2 hours. Okay, so we definitely need to address pressure care or pressure management when someone is in that shower commode. So again, exactly what Claire said, going back to your assessment, actually understanding what are some of the things that your clients are doing with that piece of equipment. Do they spend a prolonged period of time? For one client, it may be 30 minutes on a shower commode. For the next, it could be 2 hours. And you may not be aware of that unless you ask that question. Some shower commode, you can actually change the seat to, for example, they call it the pressure care seat. Allows better immersion, but not too much, because then it can be quite difficult if the person is still transferring in and out independently. So immersion and envelopment, so they call that pressure care seat, has got a Dartex cover. Or your tilting space shower commode is another one. Okay, if someone's got a pressure injury, maybe on the IT area, being able to tilt back to pressure, to relieve or change that, what is it called now? Center of gravity, that's the word. To change the center of gravity will help with that pressure relieving. So that's shower commode. Sling, and we don't talk about sling enough when it comes to pressure injury prevention and management. The big question here is, can we or can't we leave sling in? Okay, and this is a hot debate. But most recently, I went to a conference, and the most recent evidence is that you can leave the sling in. It's not for everyone. Again, coming back to clinical practice, we never apply blanket rule to all our clients, right? So again, coming back, doing that holistic assessment, understanding what are some of the risks. If you do remove the sling, is it going to be a risk for skin tear? If you do remove the sling, is it going to be a risk for the carers, the family member that's caring for that particular person? If you do leave the sling in, what type of materials are that sling made out of? So really being able to quiz your supplier, what is this made out of? What material? What's the microclimate property like? Is the person going to sweat a lot in this sling? Is it going to make them really hot and therefore change their skin integrity? Is it going to be too slidey? Are they going to slide out of the chair or the support surface? What are the property? There's certainly slings that are made for you to leave in, and there's some that are not suitable because they may have the raised seam. That's right where the person's coccyx is. So really understanding your client, their needs, their support system, but also that sling. And going back to the supplier, really quizzing that and critically thinking through what are some of those features.
Yeah, no, that's some really good points there, I think. And I say that the foundation of all that is just being a good OT detective of knowing what your client's daily routine is. And you can ask that even if you know nothing about the equipment that's going to help solve it. You can ask, how long are they spending on a commode? What are they using for their shower? What's their sitting balance like? Those sorts of person factors and their routine factors. And then, yeah, it is interesting, that whole leave-in slings, because definitely back in the day, 10 years ago, it was like, no, you cannot. But you raise a good point, like in terms of the stress that can cause for having to remove it, or like the skin tears or manual handling risk for extra work basically to do that transfer. If otherwise you've reasoned through and can choose a product, there are products now that can be left. But obviously, if you're doing anything like that, changing something for the first time, you also need to monitor it. So if it's suddenly we're going to start leaving it in, don't just say that and then wander off and never check in. It needs to be followed up to make sure that people are checking and being very vigilant about what they're doing, and that you're following up to make sure that still works.
Yes, absolutely. And I think we can rely on written statement from supplier, but not too much. I think you would always want to ask the question, number one, but also check and monitor, like what you say, exactly, Claire. And I would, if I was to change anything, if I was to take a mattress or replace a mattress, I would make sure that for the next week that my client's skin is being monitored and being checked. And you don't have to do, all you need to do is not even 5 minutes, 60 seconds of skin assessment when the carers is showering the client, for example, or before they get transferred out of bed. Quick skin check. Yes, is there anything that's not looking, is there anything new on the skin that shouldn't be there? And then working backwards again. So yes.
Excellent. Okay, and we're going well for time, which is good. We're worried we'd talk too much, but we're doing well. For our question or last myth that we're going to bust is, I think this is the last one, isn't it? Yeah.
Yes.
The more expensive the pressure care mattress or cushion, the better the pressure management. So I think sometimes people think they spend more money, they're going to get a better product. But would you say that this is always true when it comes to pressure care products?
No, definitely no. Okay. I wish it is, because then all of us can just go, cost is the determinant of the quality, and therefore we will just go with that particular, the most expensive is the best, will be the gold standard. Then I think actually, if that was to happen, then all of us would be out of jobs. There will be no need for OTs and clinicians. Okay. So this truth or trick is actually linked to the first myth that we busted. Cost is never the determinant, okay? The best or the most expensive piece of equipment may not be the best for your client. So again, and I feel like I'm a broken record now, going back to your assessment, holistic, comprehensive assessment, looking at the person's mobility, their ability to self-reposition, their transfer, their pain, and how about the sleep quality? I'll give you an example. So, dynamic air mattress, for example, everyone thinks it's the best for pressure care or pressure injury treatment. They're more expensive. Now, if you have it on the bed for someone that is quite sensitive to noise, different temperature, vibration, because the pump kicks off at night and the person's not sleeping, then that's actually counterproductive, because we know how important sleep is when it comes to cell repair through the night. Okay, so that's a really good sort of summary to say, let's look at the person's holistically. On paper, yes, air mattress could be better for pressure care, but it is not the best solution for everyone. It's definitely not the right solution for everyone. There are also air mattresses, for example, that have higher safe working load. So I'm familiar with the Care of Sweden mattress here. So, I have the CX20 mattress that is, for example, $8,000, and we may have a CX15 that is $5,000. Why is one more expensive than the other? It's because the CX20 has a higher safe working load. So it's a thicker mattress. It can support a higher weight, and therefore, because the material that is used to produce and make that is more, and it has to be more robust, therefore the cost is higher. But am I going to sell that most expensive one to every client? Or no, because not everyone require a high safe working load mattress. So I think if we were to summarize all these myths that we busted today, it comes back to one thing, and that is the skill of being a good clinician, a good OT, going back to that assessment. If you start there and ensure that you've done a comprehensive assessment, you communicate that to your supplier and say, this is my client's needs. This is what their ability is like and what I'm trying to get to, what goal the person have. What can you supply that is going to help and match that need? So I think it's really following that process vigilantly, and I don't think you'll get that wrong.
Excellent. That is a nice summary, a nice way to finish off in terms of these myths, it is really just being able to ask the right questions. And I think the more you do it, the more familiar you know with what questions to ask. The things that you're like, oh, I didn't think about that last time, automatically become part of your questions. And so you don't need to be the product expert. You need to be the expert in their person factors, their routine, and be able to share that with the supplier who can then help you fill in the gaps, because there's always new things on the market. Unless basically all you're doing is prescribing AT as part of your role, you're probably not going to be able to keep up with it. But yeah, definitely focusing on the client factors is really important. So now, if anyone, as we just wrap up, I'll share a few more resources, but if anyone has any questions, you can drop it in the chat. Otherwise, what we'll do is we'll stop the recording shortly, and if anyone has a question they'd like to ask, not on the recording, then you'll have that opportunity for a few minutes as well before we sign off. But just for anyone that did want a bit more, I did mention that there are some other webinars that Ilissa has done with us before, which is freely available in either the Learning Library, this one that you're watching now, and the previous one will be on YouTube as well. So it was Understanding Electric Profiling Bed Functions, and then prior to that, there was one on Just Ask Me Anything, all these pressure care mattress type questions that we've covered as well. So we've touched on little bits and pieces in this short session, but if you wanted a deeper dive about anything, you go into that, or you can also contact Ilissa directly, send me a question, and if it's something that I know that's an Ilissa question, I will pass it on to her as well. Thank you to everyone who's come along live. I will stop the recording now, and you will hang around for 5 minutes if anyone has any questions. But a big thank you to Ilissa for sharing her expertise and her time once again. Truly appreciate it.
Thank you, Claire, for this joint effort again.
Thanks very much. And hopefully this has raised some awareness on this very important day as well. Lots of the stop pressure injury message is definitely getting out there. So hopefully this has just added to that as well.
Yep.